Okay. So today we're going to learn about safe transfers using our mechanical lifts. 80% of our incidents. Hello. Hello. 80% of our incidents in-house are from lifting people who are needing to utilize a mechanical lift. In this in-service, we're going to put on a little skit to show you what not to do and what to do. And we'll have some questions and surprises, so please answer as many as you can. We're going to introduce Pip. He's our patient. We have Amanda. She's our aide. Mandy. Ed. He's our helping therapist. And then we have a surprise parent that is concerned.
Pip, where are you? Hello, Papa. I'm here, Papa. Papa, I'm here, Papa. Pip. Hello, Papa.
Pip, where are you?
I'm here, Papa.
You alright?
Yes, Papa.
You okay?
Yeah, Papa.
What are you doing there? I'm looking for you everywhere. Quite glad to see you, son.
Oh, I love you so much, Papa.
I love you too. What you doing there? What you doing? What this is? What you doing here?
You're not going for it. No.
Ain't you supposed to be helping him? Ain't you supposed to be helping him?
What do you need?
What's that blue thing on that around him?
That's a Hoyer bag.
Oh, what?
A Hoyer bag.
Oh, what's this type of thing here? Lift who? Lift who? My son? Oh, no, you can't.
Papa, this is a blanket. This is a blanket.
Oh, what do you do? Oh. Come do enough. Come. Show me how to do it.
Hey, man, hey, can you help me? We need to get this patient to the doctor.
Can I help you?
Papa, I can stand.
You can stand?
Yes.
What they gonna try to do to you with this thing? This a...
What's that, robot?
It's like a robot.
I can stand.
You can stand? Oh, let's see you stand.
Yeah.
All right, show us. Come on, Pip.
See?
Oh, son, you all right? You heard something?
Oh, man, hey, I gotta go.
Oh, no, you can't go. You gotta help me. No, you can't go. No, you can't go.
No therapy today.
No therapy. You gotta help my son.
All right, we get him. Let me get some help because to be able to use this, we need 2 people, okay?
2?
Yeah, let me see. Hold on, let me see.
Let's get somebody else
Hey,
help.
Amanda, we gotta give room 300 up.
Oh, Pip, you all right? Your neck hurt? Your back hurt? Your leg hurt?
I'm okay.
You okay?
I'm okay.
Only one person want to help with that
Yes,
robot.
Papa, I like your hat, Papa.
Oh, thank you very much. I'll put it on for you. Yeah.
Okay, hey, Amanda, come on, I need some help. Busy? Well, let's do it.
Yeah, that's it. That video game. Oh, yeah, like that. There you go, Charlie.
Okay, can you guys see what's going wrong in this picture? What's that? Warrior's wrong. Okay.
Wait, what was that?
Family's gonna be in the way and the warrior's wrong.
And he's by himself.
Okay, he's by himself. I got you too.
I got this. It's there.
Okay. And the therapist was in the room by himself with his phone. Okay, so that's also correct. All right. So we're gonna replay this, but we're gonna do this the right way. Okay. So good. And also, there's one other thing that we set up. I want you to look for one thing that's wrong with this next skit, okay? What's that? Good. The Hoyer pad is not correct. The Hoyer pad is backwards and upside down.
Where's my daddy? Where's my sugar daddy?
What's happening, man?
I am very good, Papa.
Very good. Oh, what are you doing here, Hoya?
Yeah.
Oh, how many people want to help you?
I don't know, Papa.
It should be 2.
Yeah.
2?
But I can stand.
You can stand? Oh, okay. Well, what's your name? Madam, how many people want to help you? Two? Oh, thank you, thank you, thank you.
I'm gonna stand, Papa.
You gonna stand?
Yeah, I can stand.
Okay, okay, let's see you stand.
All right, hey, if you try to stand, we're going to get hurt. You're going to get hurt. So we're going to have to get up. Wheelchair, get your therapy back in that, okay?
All right.
Don't try to stand it now.
So I'm not gonna stand.
No. We'll do all the lift.
But I can stand.
That's fine, that's okay. But not right now. Not what we're doing.
All right.
Hey,
Oh, yes. I stand right.
Papa, don't leave me.
Oh, I won't leave you.
So as you can see, we need 2 employees to do this. If you're not trained or qualified, you will not be operating the lift.
all right, keep your hands, cross your hands. Just right here. Because we really need like a high back chair or a bed.
Did you confirm he's not a hip patient?
He can stand. He's not hip.
I can stand. Just knee replacement, I'm okay. Knee replacement.
But that is a good question. Where do you find out whether the person can use or cannot use a Hoyer lift?
That's probably a high
So there's several different places. There's the Card X. Where do you find the Card X? It's supposed to be on the bulletin board. And what if we don't have it on the bulletin board? Where else do we look? Where? In the computer? Under PCC? Okay, you can also ask the nurse, and if they don't know and it's not in either place, who would you refer yourself to? Therapy.
Yeah, but it's just in lazy city.
So that's another question. What happens if you get the Hoyer all the way up and it just stops working? Change the battery?
Say there's no battery.
What if there's no working battery because nobody put it on the charger?
Is there a manual that you can release it?
What's that, Deb?
Manual that you can release it manually, put them right back up?
There is a red button. It's an emergency button, and it's going to pull it, and it's a release.
And that's why these little straps.
And there's also straps there so you can guide the patient. You don't have to pull on the hands, you don't have to pull on the arms or the legs. There are little handles on the back side. That's why it's important to make sure that you have the Hoyer lift pad in the correct position so you can help utilize the patient or maneuver the patient in the proper way instead of grabbing their arms or grabbing their legs to move them in a different direction that you need them to be.
Papa, I'm done.
Okay, so does everybody, we're also going to show you the correct way to do a sit-to-stand lift. The sit-to-stand lift. Do you guys know the difference between a sit-to-stand and a Hoyer lift? Okay. What is the difference? What's the main difference?
Just right.
Okay, so they can stand, but they don't have a lot of strength in their legs. So when you use the sit-to-stand lift, if you don't have a lot of strength in your legs and it's all upper body, you can pull yourself up, but you're going to be kind of like this. You'll see. Pip will demonstrate both for us.
Earlier it was working. Check it. So it means that's the last bar that would be.
Okay, so the battery, it looks like, is done. So that's another reason why we have to go ahead and we have to charge the batteries at all times. If we have an emergency and patient's on the floor, excuse me, patient's on the floor, how are we going to get them up if they can't stand? A sheet, okay. But what if the patient is really heavy and you're going to hurt your back? So, call 911, okay. We do have the proper equipment in the facility to be able to utilize at all times. But we're not going to be able to utilize the proper equipment if we don't take care of our equipment. Put this spare battery on the chargers, just like this situation. We don't have an extra spare battery. We can't use the equipment if we even wanted to. So we could be sending that. We should not be utilizing an emergency service just to pick somebody up off the floor if we can do it ourselves. So we have to work as a team and make sure that we have the equipment taken care of and properly placed.
I got a question, maybe I can win a prize.
Okay. Yeah.
So since we have 4 different units, I mean, if we really need it, we can go down like 200, 100, and actually get another battery, so we can't say that we don't have batteries. So we actually have the equipment, we just gotta find it.
That is. So does everybody know where the batteries are kept in the facility?
Nurse function.
Nurse function? Where in the nurse function?
Where the oxygen at?
The oxygen room?
Where they keep the oxygen at in here.
Okay, that's one place. CNAs are not allowed in the med rooms.
No.
So you have to be, it's easily accessed in the utility room. What's that? The O2 rooms where you get the fresh O2, not the empty O2 oxygen tanks.
Right.
Okay. Do we have any questions, any concerns, anything else that we can cover? The harness is gone behind his back, right? Yep. Okay. Okay. So that concludes it, guys. Sorry. Shut it off. So. Okay, that concludes our in-service for today.